Hello, my name is Dr. Brian Moores at Bariatric Medicine Institute, and today I'm going to be going over your bariatric discharge instructions. This is a short video to go over the 4 most important things for your success after surgery. Today I'm going to go over diet, wound care, medications, and follow-up. There'll be a second video that has some more detailed information about frequently asked questions. But in general, if you stick to these 4 specific instructions, you're going to do great in your first month after surgery. So to talk about diet, the most important thing is that you're going to be on liquids for 2 weeks and then soft foods for 2 weeks. The most important thing on the liquid phase is that we want you to try to get to 60 ounces of liquids a day. And of that, typically half of that's water or some type of Gatorade Zero, and half of that is something with calories in it. So typically 2 protein shakes or some type of pureed soup or other liquid protein meal supplement, okay? Getting to 60 ounces of both liquids and protein shakes really helps prevent dehydration, hypoglycemia, as well as constipation. Now, be really careful. Once or twice a year, we'll have people that don't follow the dietary instructions, and they may be doing solid foods in that first week or 2. And we have had patients cause bowel obstructions, and it's extremely rare, but even gastric or anastomotic perforations that have required emergency surgery. So please be very strict as you stick to the diet. The key thing to know is that as long as whatever you're drinking or eating can go through a straw, it's safe. There are some things on your diet like cream of wheat or Greek yogurt that don't quite go through a straw, and those things are safe, but it's more really towards the end of the second week, okay? At your appointment at the 2-week visit, we'll talk more about the soft food phase and then the normal food phase. Next, I'm gonna go over wound care instructions. So for your wounds, you have sutures that are holding together the skin, and they're on the outside. You will need to take those sutures out in 3 weeks. Your hospital or the surgery center will be sending you home with a suture removal kit, and they'll give you some instructions on how to remove those sutures. If you don't feel comfortable or you don't have a family member that feels comfortable removing those sutures, you can also call our office and make an appointment with a medical assistant or a nurse to have those sutures removed at the 3-week mark. The key things on the incisions are to watch for redness that's very tender, painful, spreading, and is warm. That could indicate a skin infection. Typically, we'd want you to take pictures, send them to us, or call us so we can have a visit. The other thing is that it's safe to shower with soap and water the day after your procedure. You may or may not have bandages over your incisions, and those can be removed 24 hours after the surgery. Those are mainly just to catch a little bit of spotting, bleeding, or drainage, and you may have a little bit of spotting or drainage from the left or the right incisions for a day or 2. So some patients will elect to put a Band-Aid over them for the first couple days until things dry out, okay? The binder that you have, you may wear all the time or not at all. It's up to you. The abdominal binder is for your comfort, and it just gives people some relaxation and kind of holds like it's keeping things in. Some people find it too constrictive and don't wear it at all. Again, the binder is mainly for your comfort. That's wound care. Again, sutures come out in 3 weeks. You're safe to shower with soap and water the next day. Your bandages come off within the first 24 hours. And the binder you can wear as much or as little as you want. And then watch for things like pus-like drainage or redness that's spreading and painful. There's always a little rim of redness around the incisions, and they're always itchy around the 10 to 14 day mark. The next thing that I'll be going over today are medications. We've gone over most of these in our pre-op instructions, so I'm gonna go over the most important parts on the medications. You're being sent home with pain medications, and you can take that as needed. There's nausea medications and cramping medications. The most important medication that you are mandated to take is Eliquis. Eliquis is a blood thinner that will prevent blood clots for the first month. And your first dose of this medication is the 2nd day after your surgery at night. That's your first dose. And then every day after that, you take it morning and night morning and night for 1 month, and that prevents blood clots in the calves and blood clots in your lungs. If you still have a gallbladder, you'll also need to take ursodiol twice a day. And there's no rush on that medication. In general, once people are eating soft foods or they're taking their vitamins, then they're generally taking the ursodiol morning and night. So it's usually by the end of the first or end of the second week, people have started that medication. It is a little bit larger, and so first you want to make sure that some soft food or pills have gone well. Okay. If you have home medications such as diabetes medications or blood pressure medications, Dr. Moores will go over those specifically for you, but in general, you want to resume all of your home medications. If you're on diabetic or blood pressure medications, we recommend that you make a visit with your primary care doctor or whoever prescribes them within about 1 month to adjust those medications, as your blood pressure or your blood glucose may improve and you may not need them. So if you get symptoms like dizziness, lightheadedness, low blood sugar, those would be reasons you might need to adjust the medications, and you can either call our office or you can call your prescriber to make an adjustment. The last thing I'll be going over today is follow-up. So today you've been deemed safe for discharge, your vitals are looking good, if you had labs obtained, they're in the normal range, and your physician has talked with your nurse and you've had no major events that prevent you from going home. For follow-up, we like you to stay closely involved with the office. So typically you'll receive a call from our nurses on the Thursday or Friday after your surgery, and they're gonna touch base with you to make sure that you're doing well at home and ask if you have any issues or follow-up questions at that time. And then you'll be scheduled in 2 weeks to see either a PA with the practice or Dr. Moores or Dr. Cottom for your 2-week follow-up. But we're always available before those first 2 scheduled visits. So if you have problems or issues, we always recommend that you call the office with questions. Our medical assistants answer questions during the daytime, and if they're not available to answer questions, or if they don't know the answer, they'll talk to one of the PAs or the physicians and they'll call you right back. After hours, the physicians are always available. So if you have an emergency on the weekend, if you have an urgent issue in the nighttime, if you need a new prescription that's empty, you can call the office, hit option 1, and the answering service will collect some info and they'll page your surgeon to call you back. Okay, so there is always a provider or a healthcare team member available 24/7 to answer questions. If things aren't urgent, we do prefer daytime hours, but again, there's always someone available. And in general, in the first month, we prefer that you always call the office about issues, as we try to avoid urgent cares and ERs to help us troubleshoot issues. Our office can get you anything you need. We can get labs done, IV fluids, CAT scans, typically done the same day, but our office needs to be aware of that in a timely fashion. If you're calling at 4:40 p.m., we don't have a lot of time and it might be the next day before we can get testing done. All right, that's follow-up. So we've gone over 4 things today. We've gone over diet, wound care, medications, and follow-up. I'm excited for your bariatric journey. This is just the start of it. Please call our office if you have any questions, and there'll be a second video about frequently asked questions where we'll go over some more detailed information about commonly asked questions. Best wishes.